So my name is Emily Parsons, and for this video demonstration, I'm going to perform a head-to-toe assessment. This is going to be a limited assessment. First, I'm going to inspect the head. I'm going to palpate the skull. It appears to be normocephalic with no lumps or knots. Do you have any tenderness in your head?
Not my head.
I'm going to palpate the arteries. Everything feels normal. Can you smile for me? Your face appears to be symmetric. You don't have any weakness or involuntary movements that I notice. Next, I'm going to do an eye assessment. So if you could just look up at the ceiling, I'm going to assess your conjunctiva and your sclera. Sclera is white, conjunctiva is pink. Everything seems to be within normal limits. I'm going to hold up a Snellen chart. I'm going to stand 10 feet away. Can you cover your left eye and read the farthest that you can see?
E, D, F, C, Z, P.
And then the other eye?
F, E, L, O, P, Z, D. So
the left eye appears to be 20/40 vision and the other eye appears to be 20/32. Next, I'm going to assess cranial nerves 3, 4, and 6 by doing the 6 cardinal gaze positions. So if you could just look at my finger and follow my finger only with your eyes, we're going to go left, up, left down, right, right up, right down. Everything appears to be in normal limits. I don't notice any nystagmus. If you could stare at my finger, I'm going to check your accommodation. I'm just going to move it closer to your nose. Just follow it with your eyes. The pupils will constrict. I'm going to dim the lights and shine my headlight in your eyes to assess your pupils. So if you could just look straight ahead for me. It's going to be a bright light. Perfect. And then the other side, bright light. Just look straight ahead. Pupils appear to be equal, round, and reactive to light. They both are 4 millimeters and round. Next, I'm going to inspect your ears. I'm going to palpate. Do you have any tenderness?
in front of my left ear, yes.
Okay. Front of the left ear. I'm just going to take my light and examine the external part. I don't notice any redness or swelling. Again, no redness or swelling. Also, no lesions or discharge, and only tenderness to this side. I'm going to perform a hearing test now to see how well you can hear. So I'm going to whisper. You tell me what I say.
Mercy's
Hospital. You can hear perfectly. You passed that test. Next, I'm going to inspect the nose. I see that there are no deformities. I'm just going to palpate. Any tenderness in your nose? Can you pull up this side of your nose? And okay, and then the other one. The nostrils are patent. Do you have any tenderness on the inside or anything like that? Have you had any discharge recently?
not on my nose.
I have some Bath and Body Works lotion here. Could you smell this and tell me? Do you notice the scent?
Yes.
Can you guess what it is?
Something flowery.
Okay, champagne toast. I'll take that. You have a good scent. Everything is within normal limits. Paint the sinuses, just right through here. Any tenderness? Up here? On this side. Sinuses were not swollen that I noticed. Now we're going to inspect the mouth and throat. Can you stick out your tongue for me? Everything looks normal. I don't notice any lesions. Are you able to open and say ah?
A little bit.
The uvula looks normal. It rises at midline. I'm going to elicit a gag reflex. Everything's within normal limits. I'm just going to palpate your lips. I don't notice any lesions, and then your tongue as well. There's no lesions there. Everything is within normal limits. Teeth appear fine. I don't notice any missing teeth. Floor of the mouth looks great. Tonsils are both in place. I didn't notice any edema. Cranial nerve number 7 is intact with her tongue sticking out. Next, we're going to move on to the neck. I'm going to inspect and palpate the lymph nodes. I don't notice any, do you have any tenderness in your lymph nodes? Okay. I don't notice any swelling. There's no lesions. It is smooth, soft, and symmetrical, non-tender. So I'm going to do a range of motion on your head right now. Can you put your chin to your chest and then look up at the sky? And we're going to go side to side. Any tenderness?
No.
Everything is within normal limits. The only complaint and abnormality thus far in the assessment is the left jaw. She does have some discomfort there, so I would recommend oral maxillofacial surgery. You should go see a provider about that.
We'll call in the morning and try to get an appointment.
Shoulders up for me, and then put them back down, and then do it with some resistance. Any discomfort? Next, we're going to move on to the chest and lungs. I'm going to inspect and palpate anterior and posterior, so if you can sit on the side of the bed for me. Any difficulty breathing?
No.
I'm just inspecting to see if there's any lesions or knots. Any tenderness? Okay, everything feels normal. I'm just going to listen to you. Take a deep breath. And exhale. Deep breath. And exhale. Deep breath. And exhale. Deep breath. And exhale. And one more time. Deep breath. And exhale. Your lungs sound clear, your chest is symmetrical. I'm going to come back here, I'm going to listen to the back bases. Once again, deep breath, and exhale. Deep breath, and exhale. Deep breath, and exhale. Deep breath, and exhale. And then one more time, deep breath and exhale. Everything appears to be within normal limits. Chest expansion is equal. There's an even rise and fall within her breathing. I'm now going to assess tactile fremitus. I'm going to have you to say 99. While I go down the back side, I'm going to feel for an equal vibration. That would be my normal assessment. So go ahead and start saying 99.
99.
And again.
99.
And again.
99.
And again.
99.
And again.
99.
Even vibrations throughout. Everything is within normal limits. Moving on to the neck vessels and heart. Can you turn your head to the left for me? I do not notice any jugular vein distension. I'm going to palpate the carotids one at a time. It feels normal, and then the other. And it feels normal. Next, I'm going to palpate the apical impulse, which is going to be on the 5th intercostal space. So I'm just going to feel everything feels normal. And then I'm just going to listen to your heart. I'm going to listen to the ape to man algorithm. So if you could lean forward and slowly exhale. And then I'm going to just listen to all aspects of the heart lobes. Everything sounds normal. I'm just now going to use the bell of my scope and listen to the apex, which is also going to be located in the 5th intercostal space. Everything sounds to be within normal limits. I heard S1, S2, no murmurs are noted. We have a equal rhythm and rate. Next, I'm going to inspect the abdomen. If you could just lay back in the bed again. Can I inspect the skin?
That's fine.
Everything looks normal. The skin looks fine. I'm going to listen to the bowel sounds now. And I'm going to listen in all 4 quadrants. You have normal active bowel sounds. I'm just going to palpate. Do you have any tenderness in any of your quadrants? No tenderness noted. Everything looks symmetrical. It is soft and non-distended. Moving on. Also, there was no bruit noted, so no murmur. Everything was within normal limits. Next, we're going to do the upper and lower extremities. I'm going to palpate the skin, the nail, the shape. We're going to check for edema. No edema noted. The skin is normal. Capillary flow is less than 3. Again, everything is normal. Skin color, warm to touch. Capillary flow is less than 3. I'm going to do the feet. Skin is normal. Capillary flow is less than 3. No edema noted throughout. I'm going to check for your skin turgor. I'm just pinching up on the skin that I can find. It's there. And it is normal. You are well hydrated. I'm going to feel for pulses now. Radial pulses are a +2. Pedal pulses are a +2. Do you have any numbness or tingling in any of your extremities?
Sometimes in my legs, some tingling.
Okay. You should probably follow up with a neuro for that. You need to make a lot of appointments when you get home.
I'm not a good picture.
The temperature was also warm in all of the extremities, and I didn't notice any varicose veins, so everything is within normal limits for that. Next, we're going to do musculoskeletal. I'm going to inspect and palpate, and while you perform all range of motions in your joints. Can you shrug your shoulders up for me? And back down. Is your arms up? And up again. And back down. We're going to turn our hands over. Any discomfort? Do you have any pain or tenderness? Okay. Can you put your one hand behind your shoulder? Okay, and then the other? Perfect. I'm just going to feel for the joints here. Everything feels within normal limits. And then the elbows, within normal limits. Wrists, within normal limits. And then the hands. Everything feels to be within normal limits. I don't notice like any knots. And no crepitus. You don't have any discomfort. We can rotate our wrists. Can you squeeze my fingers? Pull me towards you. With some resistance. Okay, and then push me away. Perfect. I'm going to push down, you pull up. Okay, and then the other way. Full strength. We're going to check out the lower extremities now. I'm going to put your foot down. Your motion in your hips, knees, and ankles. So with this leg, can you pull it up to your chest? Any tenderness or discomfort? Okay. Hold this leg up. Can you move this leg under? Tenderness, discomfort? Okay, we're going to do the same with the other. We're going to put it to your chest. Tenderness or discomfort? Pull this leg under. Tenderness, discomfort? Okay, you can put everything back down. I'm going to palpate the hip bones and the knees and the ankles and then the feet one more time. Everything appears to be within normal limits. You can push your feet up. Okay, and then push on my hands. You have good equal strength. You take this foot and rub it along the shin. And then do the same for the other. Any tenderness or discomfort?
No.
Everything appears to be within normal limits. Can you stand up and touch your toes for me? And while you do this, I'm going to palpate the spine. I'm just palpating the spine. Do you have any tenderness or discomfort?
No.
I don't notice any curvatures or deformities. Everything appears to be within normal limits. And I'm just gonna have you walk across the room. I'm noticing you have a normal steady gait. Do you have any pain or tenderness when you walk?
Not really.
Okay. And then come back across the room. Everything appears to be within normal. I'm gonna have you to stand up and hold onto the edge of the bed and just bend one knee and then the other. Any tenderness or discomfort?
No.
Okay, the musculoskeletal portion of this is over. Everything is within normal limits. The last thing that we're going to do is a neurological assessment. I'm going to assess the sensation in your arms, hands, feet, and legs. So I'm going to have you close your eyes. And you tell me if this is a sharp touch or a soft touch.
Soft. Kind of sharp. Soft. Short.
Everything is within normal limits. Now I'm going to do the same with your feet. So she can see.
Short. Short. Soft.
And then the other.
Soft. Soft.
What was that one?
Soft. That one was kind of short.
Okay. Everything was within normal limits. I'm going to have you hold your fingers out and just touch your fingers to your nose. One at a time. Perfect. And then the other. Okay. Good job. That's just testing the cerebellar function. We're going to do the Romberg test now. Can we stand up and put your feet together, arms at your side, close your eyes, and try to keep your balance. I'm just going to time you for like 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, everything appears to be within normal limits. If you could close your eyes and hold out your hands, I'm going to draw a shape in your hand, and then you tell me what shape I'm drawing.
A circle.
Yes.
A star. A circle.
Okay, yes. I'm going to put an object in your hand, and then you tell me what it is.
Pen.
Yes. And then the other.
Is it a Q-tip?
It's a Q-tip. Very good. Everything is within normal limits. The last thing that we're going to do is deep tendon reflexes. So if you could once again just sit on the bed for me. I'm going to take my stethoscope. Okay, and then the other. Everything was within normal limits. You do have normal reflexes. I am going to now take my Q-tip. If you could sit back in the bed one more time, we're going to look at your feet. I'm going to do a plantar reflex. I'm just going to swipe the bottom of your foot. Do not kick me in the face, please. Okay, and here we go. Okay, and then the other. Everything was within normal limits. The toes curled in as they should. Had it been abnormal, her feet would have fanned out. And that concludes my head to toe assessment. Thank you for watching and thank you for participating.